What's up, future nursekies? I hope everybody's staying healthy. We are witnessing history in the making right in front of our eyes. This novel coronavirus has gone crazy and viral, no pun intended. It's spreading so fast and furious like they're on some kind of mission. And I guarantee you that in the future, virtually every single textbook will talk about what's happening today, and that's including your nursing books. So now, we'll go over what we know so far of COVID-19 as easy as ABC. How it happens, what you'd notice, and how to manage it. So let's get started. How it happens. So COVID-19 stands for Coronavirus Disease 2019. It's caused by the virus called Severe Acute Respiratory Syndrome Coronavirus 2, or in short, SARS-CoV-2. Besides its long name, as you might have noticed, it has a number 2 on it. That's because its molecular structure is very similar to the virus that caused the SARS outbreak in 2002. SARS-CoV-2 is also known by its other names, such as the Wuhan coronavirus due to its perceived origins in Wuhan, China, or the novel coronavirus. Novel referring to being new. It's a new strand of coronavirus that humans have not seen yet, so we really had no way of preparing for it. The name corona is Latin for crown, or meaning that surrounds. That's because the virus, if you look at it very closely, had protein spikes all around its structure. So far, what we know about this virus is that it has an average incubation period of 5 days before symptoms begin to appear. It is believed to have originated from animals, from bats to pangolins, but the exact source is not entirely known. This RNA strand virus mutated its genetic code and now causes COVID-19 in humans. Now, it is spreading so fast and so far the entire globe that the World Health Organization declares this as pandemic. It is spread between humans to humans via droplet transmission, meaning when somebody coughs, sneezes, spits, or even sings or talks, the virus can travel within the droplets by air up to 1 meter or 3 feet. It is not known at the moment how long the virus can survive outside, so anybody in close contact with it or unknowingly touches the droplet on surfaces that it may land it on can definitely catch it. But the population at most risk for developing COVID-19 are those with pre-existing health conditions, such as with heart disease, lung disease, diabetes, the immunocompromised, and of course, the older adults. What you'd notice. COVID-19 is diagnosed through clinical manifestations, a positive RT-PCR test or reverse transcription polymerase chain reaction, which detects a very small amount of the virus in humans. But at the moment, accuracy of this test is being questioned, and a positive chest X-ray or CT scan looking abnormal. Clinical manifestations will vary for individuals based on their health status, from being asymptomatic to mild and severe. Some might even carry the virus and look completely healthy, and some will be in clear respiratory distress and will need immediate help. In general, this novel coronavirus produces flu-like symptoms, so it's good to assess for fever, fatigue, malaise or muscle weakness, a dry cough, dyspnea or hard time breathing. Less common symptoms might include sputum production, headache, hemoptysis, and GI symptoms such as nausea, vomiting, and diarrhea. And those with pre-existing comorbidities, the chances for developing severe conditions are much higher. And these complications can include pneumonia, acute respiratory distress syndrome or ARDS, in which the body does not respond to high levels of oxygen, And septic shock is a type of distributive shock in which the vital organs are not able to receive enough blood, and in rare cases, death. How to manage it. Prevention is key here. To those that do not have COVID-19, start educating them on prevention. You want to teach that frequent hand washing is the single most effective step that they can take. Avoid traveling to outbreak areas, staying away from those who are sick and crowded places, and avoid touching the eyes, nose, and mouth. And if you are taking care of a client who has COVID-19, before even having contact with them, you want to wear the appropriate PPE, including gloves, gowns, splash shield, and an N95 mask if there are any possible aerosol production activities involved. You want to place the client in an isolated room with the doors closed. And in addition to standard precautions, you want to follow droplet, contact, and airborne precautions as well. At the moment, there is no cure nor vaccine, so the focus of treatment is supportive care. You want to frequently assess the client's temperature, vital signs, respiratory status, their mental status, including any lab work such as AVGs and fluid and electrolyte values. You want to facilitate deep breathing exercises and the use of incentive spirometer, oxygen therapy, chest physiotherapy, and suctioning if needed. You also want to place the client on bed rest and ensure proper nutrition and adequate fluid intake if not contraindicated. Be aware that the client may require intubation and mechanical ventilation if their condition worsens. And you also want to provide emotional support using therapeutic communication techniques. Alright, so to recap, COVID-19 is a disease caused by SARS-CoV-2, a novel coronavirus that is believed to have originated from animals and mutated its way to infect human beings. The World Health Organization declares COVID-19 as pandemic, and it is spread between humans to humans via droplet transmission. Prevention is key here, with frequent proper hand washing, the most single effective step the community can take to protect themselves and others. The clinical manifestations vary, but common symptoms are fever, fatigue, malaise, a dry cough, and dyspnea. Treatment is focused on supportive care, and nursing responsibilities are frequent monitoring of clients' health status and facilitating intervention that help ease the client's respiratory status as well as emotional support. Alright, so that's the end of the video, and I just want to say I appreciate all you future and current nurse keys out there who decided to learn with me here. And obviously, COVID-19 is a new disease, so as time goes on, there will be updated information on how to evaluate it and manage it. And I encourage you to go to the World Health Organization website and the Center of Disease Control website for more information. And I'll post the links here in the descriptions below. And if you found this beneficial in any way, shape, or form, please like, comment, and subscribe. Thank you so much again. Stay safe and stay healthy, everyone.